So what should you expect during a root canal treatment? So the first thing the doctor will do is to make a diagnosis. This will go by listening to your symptoms and then doing proper investigations such as x-rays to make a proper diagnosis to determine that you actually need a root canal treatment done. So depending on the tooth in question, it might be a 1-step or 2-step appointment as the doctor deems fit. So some of the process that we'll go through is to remove the infected pulp, which is the innermost part of the tooth containing the nerves and blood vessels that might be infected. And then after that, we'll clean the tooth. And then the third process will be to fill the root canal process and then fill the tooth. In most cases, if the tooth was very badly broken down or damaged, the doctor will also recommend for you to have a prosthesis such as a crown so that the tooth is very stable and can serve you for many, many years.